Hi, my name is Ada Graham. I'm an assistant professor of surgery in the Division of Colon and Rectal Surgery at Johns Hopkins Medicine in the National Capital Region. I see patients and perform their surgeries at Sibley Memorial Hospital and Suburban Hospital. So I specialize in colon and rectal surgery. What that means is I take care of a broad variety of diseases, including benign disease, which means non-cancerous, and malignant disease, which is cancer. So things that I treat involve such diseases as diverticulitis, rectal cancer, colon cancer, inflammatory bowel disease such as ulcerative colitis and Crohn's, hemorrhoids, anal fissures, and pilonidal disease. My research focuses on inflammatory bowel disease such as ulcerative colitis and Crohn's, and on quality improvement initiatives. These are things such as ERAS, which is Enhanced Recovery After Surgery, which is working on getting a patient safely out of the hospital more comfortably and more quickly. I came to medicine from a roundabout way. I actually started with a degree in linguistics at Dartmouth and then promptly moved abroad to Thailand to teach English, and additionally did things such as park ranger in New Zealand, neuroimaging research at the University of Chicago, before eventually deciding that what I really wanted to do was to practice medicine. After all, there's very few fields where you get to use your heart, your head, your hands, and really make tangible improvements in people's quality of life. As to why I decided on colon and rectal surgery, it's one of the surgical specialties where you really have the option and the privilege to be able to make really great improvements in folks' quality of life. While most folks, when they think of colon and rectal disease, oftentimes think of cancer, a lot of the conditions that we treat that are not cancer, we really have the ability to make a huge change for the better in folks' quality of life. So if someone's had horrible ulcerative colitis for years, I make it so that you're not tied to the bathroom and you can go on that road trip. If you've had terrible hemorrhoids, now you can sit comfortably in your office chair. My goal is to get you to where you want to be. A patient's job is not to be living in the hospital or be living in a doctor's office. What I like best about working with Johns Hopkins is I get to meet everyone where they are. So I can take the work from their referring providers and then work with a multidisciplinary team to really tailor each patient's individual care plan to what best suits their needs, their wants, their goals. Because that's what my job is to get people doing the things that they want to be doing.